CPT Integumentary 10,000 Series Practice Questions and Answers, 35 Essential Questions. Question 1. Patient has a 7.6 cm simple repair of the right forearm and a 5.7 cm intermediate repair of the upper right arm. How are these coded? 12,004, 12,032 to 59, 12,004, 12,034 to 59, 12,034, 12,004 to 59, 12,032, 12,004. Simple repairs and intermediate repairs are coded separately. 12,004 is for simple repair of extremities 7.6 cm to 12.5 cm. 12,032 is for intermediate repair 2.6 cm to 7.5 cm. Modifier 59 is used to show separate procedures. Question 2. What is the code for a 4.7 cm complex closure of the neck? 13,132, 13,131, 13,101, 13,152. CPT 13,132 is for complex repair of the forehead, cheeks, chin, mouth, neck, etc., 2.6 cm to 7.5 cm. Question 3. A physician performs an excision of a 2.4 cm malignant lesion on the left ankle with a split-thickness skin graft. Which code set is likely? Excision and graft codes. Repair codes only. Incision and drainage codes. Destruction codes. The removal of a malignant lesion requires an excision code, and a split-thickness skin graft requires a separate graft code. Question 4. What does modifier -59 indicate in the 10,000 series? Distinct procedural service, staged procedure, bilateral procedure, multiple surgeons. Modifier 59 is used to indicate that a procedure was distinct or independent from other services performed on the same day. Question 5. How is the length of multiple simple repairs in the same anatomical group handled? Summed together, coded separately. Only the largest is coded. Average length is used. CPT guidelines state that when multiple repairs of the same classification, simple, intermediate, or complex, are performed in the same anatomical group, the lengths should be added together. Question 6. Which code range covers the integumentary system in CPT? 10,021 to 19,499, 20,000 to 29,999, 30,000 to 39,999, 90,000 to 99,999. The 10,000 series, 10,021 to 19,499, covers the integumentary system. Question 7. What is an intermediate repair in CPT coding? Requires layered closure. Only involves the epidermis. Requires extensive cleaning. Involves bone repair. Intermediate repair involves layered closure of one or more of the deeper layers of subcutaneous tissue and superficial, non-muscle, fascia in addition to the skin. Question 8. A patient has 3 2 cm simple repairs on the trunk. What is the total length coded? 6 cm, 2 cm, 4 cm, 8 cm. The lengths of simple repairs in the same anatomical group, trunk, are added together. 2 plus 2 plus 2 equals 6. Question 9. Which code is used for the debridement of skin, subcutaneous tissue, and muscle? 11,043, 11,042, 11,044, 11,000. 11,043 is for debridement down to and including muscle. Question 10. What is the term for a graft where the donor and recipient are the same person? Autograft, allograft, xenograft, isograft. An autograft is a tissue graft from one's own body. Question 11. Code 10,060 is used for what procedure? Simple incision and drainage of abscess. complex incision and drainage, paring of calluses, shaving of epidermal lesion. 10,060 is for simple or single incision and drainage of abscess. Question 12. When coding excision of lesions, what is included in the measurement? Lesion diameter plus narrowest margins. Lesion diameter only. Margin width only. Circumference of the lesion. The size of the lesion for coding purposes includes the maximum diameter of the lesion plus the narrowest margins required for complete excision. Question 13. Which of the following is considered part of the extremities anatomical group for repairs? Hands, neck, face, trunk. Hands and feet are often grouped with extremities in repair code definitions, though some ranges differentiate. Question 14. What is a 15002 code used for? Surgical preparation of recipient site, split thickness graft, full thickness graft, pedicle flap. 15002 is for surgical preparation or creation of recipient site, first 100 SQCM. Question 15. What is a Mohs micrographic surgery? Surgery with immediate microscopic exam, laser removal of hair, cryosurgery for warts, aspiration of a cyst. Mohs surgery involves removing a tumor in stages and examining each stage under a microscope immediately. Question 16. Which modifier is used for a staged or related procedure? -58, -50, -51, -59. Modifier 58 is used for a staged or related procedure performed during the postoperative period. Question 17. What is code 17,000 used for? Destruction of premalignant lesions, excision of benign lesions, simple repair, biopsy of skin. 17,000 is used for the destruction of premalignant lesions, example actinic keratoses. Question 18. What is the code for a single punch biopsy of the skin? 11,104, 11,102, 11,106, 11,100. 11,102 is for a tangential biopsy, but often the 1110X series starts with 11,104 for punch biopsy, first lesion. Self-correction, 11,104 is first punch, 11,102 tangential. Question 19. How is a 12 cm intermediate repair of the scalp coded? 12,034, 12,035, 12,005, 13,121. 12,034 is for 7.6 to 12.5 cm intermediate repair. Scalp is grouped with trunk/extremities for intermediate. Question 20. In integumentary coding, does simple repair include chemical debridement? No. Yes. Only if over 10 cm. Only on the face. Simple repair is used when the wound is superficial and requires simple one-layer closure. Debridement is separate if extensive.